Now we'll start with our session. So today's topic is very important one from our point of view, because this is the topic such types of patients always comes in our homeopathy practice. Off and on they comes. When you do homeopathic practice, out of homeopathic practice, nearly about 40%, 30% cases are of spinal canal disorders. So big part of your OPD will be definitely of a spinal canal disorders, and how to manage them. This is very important. Very important thing is that how to manage the spinal canal disorders. Generally what happens that it has been wrongly claimed that homeopathy never deals with the mechanical problems and spinal canal disorders are more of a mechanical. It is not so, and this is what I want to show you. Only thing is that we never learn them properly, and that's why we never understand. So today's topic is most practical one, spinal canal disorders. And before going into the spinal canal disorders, we have to learn certain things regarding the understanding of human being. We have to understand little bit anatomy so that we can understand spinal canal disorders in a proper manner. So first thing what is needed is nothing but the understanding the human being. Human being is made up of two parts, the visible and the another part is invisible. What is visible? Visible is in front of you, invisible is interior, which you cannot find it out. Only the expressions are there. So basically, it is too important to understand the human being, the physical human being, at the same time invisible. When you deal with the spinal canal disorders, both things are necessary to reach to the right simillimum, to find it out the right remedy. The first part is more important when you deal with the spinal canal disorders. And that's why first thing is to learn them. But the dynamic aspect is also there. And that's why first thing, what is dynamic aspect? The invisible human being. Two important parts. The vital energy, because of which we are animated. Because of which we are gathered together to learn something. Because of which we have a will. Because of which we have a mind. Because of which we have emotions, the intellect, the understanding, the logic. All those are the expressions of this vital energy. So that aspect individualizes one patient from the another patient. That aspect gives you a different understanding of the human being. And that's why dynamic human being, learning a dynamic human being is also an important part, and which you can learn in your curriculum. Today we are going to learn more of the physical human being. So in the physical human being, basically when we look towards it, we have to go for understanding few things. Why there are so much of spinal canal disorders? In a modern era, there are two varieties of people which you can find. Ek variety paila one variety which you can find it out, those who are heavy workers, who used to work in field, farmers, they used to work a lot, heavy workers, suffers from degenerative disorders very common. I used to take a camp nearly about 20 years at villages, different places. We used to do a camp. That is the Alkuti, Bella, Maskewadi, Digos. All farmer people they used to come for. And they were suffering from off and on only with the disorders which are degenerative type of disorders, basically of the spinal cord, because they used to carry a heavy weight. They used to do a very hard work. So heavy work is one of the important things because of which spinal canal disorders are there. And second part, the absolute no work. People who used to just sit only on the table and chair, finished in front of computers. No at all, no motion of the body. Sitting in a one place doing a computerized work, that's all, using their intelligence. Because of that sedentary life, because of sitting in one place, they used to suffer from the spinal canal disorders. So neck problems, mobile workers, they always get a cervical spondylosis very early. This is very common in early age, young population, only because they are looking continuously with the mobile. They don't know how to utilize mobile, how to look up with the mobile. So these are common things. The disparity is there in our either heavy workers, either absolute no work. Both things can lead to spinal canal disorder. So we have to learn basically the anatomy, the visible anatomy. So this thing is very important to understand. What is there? A spinal cord is there. There are 7 cervical vertebrae, 12 thoracic vertebrae, the 5 lumbar, the 5 sacral fused, and 3 first 6. They are also fused over there. And with this, the spinal cord is there. We look straight. When we look towards the human being, we look, he is straight, but he is not straight. This is the curvature, continuous, followed in our body. It should be maintained, but we never maintain that. If we maintain that, we never suffer generally from disorders, but we never sit erect. How do we sit? आपण कसं बसतो? No one sits straight. Everyone sits either bending forward. How do we study? We study in same posture like this. Because of continuous, and actually what type of curvature should be maintained in between the thoracic vertebra, we exactly do the opposite, and that's why we generally suffer from the postural backache. So this lordosis and kyphosis, those curvatures are very important to understand. So this curvature of the spinal cord plays a very vital role. So there are 7 cervical vertebrae, C1 to C7, thoracic. There are 12. They are either called as dorsal vertebrae, D1 to D12 or T1 to T12. 5 or 6 lumbar vertebrae, low back L1 to L5. Sacral 5 fused in the pelvis area. They are S1 to S5. And last, the first 6, the 3, the tailbone, which is called as tailbone. Someone have uttered it in monkey bone. It is not monkey bone. Monkey bone. So it is not a monkey bone. It is called as tailbone, which is made up of 3 vertebrae. These are the curvatures. First is the cervical. It is lordosis. Lordosis means what is lordosis? Lordosis is convex anteriorly. पुढच्या बाजूने convex, पाठीमागच्या बाजूने concave. Convex म्हणजे काय? फुगीर. Convex म्हणजे फुगीर. This is anterior, that is posterior. Okay, so convex is like this. Cervical, the lordosis is there, the convex anteriorly and concave posteriorly. Then comes the thoracic vertebra. The curvature is kyphosis, exactly opposite. The concave anteriorly, convex posteriorly. Then lumbar, again it changes. The lumbar lordosis, it is called as normal lumbar lordosis. The convex anteriorly, concave posteriorly. The sacral is kyphosis, again opposite, and coccyx is the tailbone. So these curvatures are very important in order to maintain the health, and which are not followed in day-to-day life. And as they are not followed, generally the postural backache is the first important entity which happens early in the life, very early. Number of youngsters have a backache because they never maintain these curvatures, the kyphosis and lordosis. So this is one must know. Then one must know the anatomy of the vertebra. So the vertebral body, first one. The second one is the spinous process, which is posterior. So body is anteriorly and spinous process is posteriorly. The third one, the transverse processes, which joins the body with the ring. Then the pedicle, again in between part. Fourth one, which joins one vertebra with another vertebra. They comes closer there because there are facet joints. Then the foramen, fifth is the foramen, where through which the spinal cord runs. And last, the sixth one is the articular processes through which one vertebra joins with the another vertebra. This is, you will feel little bit boring, but this is very important to understand exactly where our remedy will going to work. For that purpose, it is too much necessary. The facet joints. Facet joint म्हणजे काय? These are the joints which gives you two types of movements. When we bend forward, so what happens actually in the vertebra? So vertebral body, in between the intervertebral disc is there, again another vertebra. So when you bend forward, the flexion which is mentioned over there, what happens? The jelly-like consistency is there in between medium. Because of which, when you bend forward, it becomes this happens, this turns downwards and it goes up. This is the flexion which happens in the spinal cord only because of the in between jelly-like consistency, the intervertebral disc which absorbs the shocks. And because of which you are protected from the backache. The pain is not there and you never feel any type of jerk. When you bend backward, this is the thing which happens. See, because of which it has been maintained. It never glides directly because of the intervertebral. So these are the flexion and extension happens to be there very easy without causing trouble to your spinal cord or without causing trouble to your body, only because of the intervertebral disc which has a jelly-like consistency. The ligaments, very important. Posterior spinal segment. Posterior, madla काय तो? It is spinous processes which we have on the back side. Then the intervertebral disc, the vertebral body, and the facet joint. One vertebra joins with another vertebra. Intervertebral disc, vertebral body, the facet joints, the pedicle, etc. This is very important. This is the disc. Intervertebral disc. कशी असते ती? It has a jelly-like consistency. The outer membrane of the intervertebral disc is called as annulus fibrosus. It is fiber-like structure, inside which the jelly-like consistency, the nucleus pulposus is there. मधली जी actual disc आहे ती कशाची बनलेली तर jelly-like आहे. त्याला काय म्हटलं जातं? Nucleus pulposus. And this is what is the intervertebral disc. Okay. So this is the common structure. It is the base of the brain, spinal cord. So from the base of the brain, spinal cord starts. The nerve roots which comes out peripherally. It ends with the cauda equina. This is again vertebral body. The nerve root, how they comes out. This word is very important. Neuroforamen, and through the neuroforamen, the nerve roots which comes out, the spinal cord is there. This is the site where you get an injury. When intervertebral disc prolapse is there, and that disc prolapses and presses on this nerve root, it immediately causes a pain. Sciatica, we used to get sciatica. The reason is that whenever intervertebral disc prolapses, either it comes to the right side or the left side. If it goes to the right side, then it causes the right sided sciatica. If it comes and presses the left nerve root, it produces left sided sciatica. And whenever intervertebral disc comes and presses over there, immediately there will be pathology. काय होतं? त्या ठिकाणी pathology तयार होते. So it causes a damage to this nerve root, nerve ending, and this is how a disorder develops. That we are going to learn. So we must know where exactly the nerve root is there. Spinal nerves, cervical 8 pairs, thoracic 12 pairs, lumbar 5 pairs, the sacral 5 pairs, and coccyx 1 pair. Total there are 31 sacral spinal nerves. Spinal nerves. Then ligaments. Why ligaments are very much necessary to understand? What happens? We never study in this manner. There are very specific remedies in our Medramedica which have a specific action. एखादी remedy आहे ligaments वर act करते, एखादी remedy ती cartilage वर act होते, एखादी remedy ती fibrous tissue वर act होते. We know exact action, but we don't know where they are present. That's why it is too important to understand that this is the vertebral column, the facet capsular ligament, so which covers the facet joints. Then anterior longitudinal ligament. So this is the anterior side of the spinal cord, vertebral body, and anterior longitudinal ligament is there which covers the anterior side. Then there is a posterior side which goes in between through and through, covering the spinal cord over there. So posterior longitudinal ligament, intertransverse ligament. Between the transverse processes there is a ligament which is called as intertransverse ligament. Then interspinatus, spinous processes between the then when it comes above the spinous process, it is called as supraspinatus ligament. These are the ligaments which might get injured whenever there are heavy lifting, if you do a heavy jerk. So this is how it happens. Jerry, I know that you are a little bit bored. Are you? No? Only last part of physiology, then we have to enter into the actual seminar. What are the functions of the spinal cord? What are very important functions? Basically, first function is that the protection of the whole body. How it protects? Spinal cord and nerve roots and many internal organs, they are protected inside that spinal column. That is first important thing. Second, it gives the base for attachment of the ligaments, the tendons, the muscles which are attached over there, and we get a erect posture because of it. The third is structural support. So it supports the head, it supports the shoulders, it supports the neck, it supports the chest, connects the upper and lower body. So this part is very important. It connects the upper body and lower body. Balances and weight distribution is there because of the spinal cord. Flexibility and mobility. Which are the flexibility? We used to bend forward, we used to bend backward, we used to turn this side, then the combination of all those movements which you used to do, all these functions are there only because of we have the spinal cord, which is the erect spinal cord. And last, bones produce RBCs. That is the basic source. And mineral storage. Another thing is that mineral storage. So this is what is in short the introduction to the spinal cord. Because this much of anatomy one must know in order to treat those disorders.